Hello, Richard Gallagher is my name. I'm a head and neck surgeon and I mainly look after patients with cancers of the head and neck. I trained as an ear, nose and throat surgeon. Today I want to talk to you about how to examine the neck, why we examine the neck, and how to examine the mouth to look for any abnormalities or early signs of cancer. The neck is divided into two big triangles that we all learned about at medical school. So there's the anterior triangle and there's the posterior triangle, separated by the sternomastoid muscle. And in front of that and behind that are lymph nodes, and deep to the sternomastoid muscle are also lymph nodes. So why are the lymph nodes important? They're important because when patients develop head and neck cancer, they may develop metastases, and the first place that the cancers tend to spread to are the lymph nodes in the neck. And we know that when they spread to certain areas, and we can feel them in different parts of the neck, that suggests where the cancer may have come from. So when we look at the neck and we look at the two different triangles, there are actually sub-sites in those triangles that we think of. So there's an area that we call level 1, which is this area previously called the submandibular triangle, and also up into the submental triangle, where lymph nodes can live along just below the body of the mandible and the mentum. And then there's level 2, 3 and 4, which are lymph nodes deep to the sternomastoid muscle, which run along the internal jugular vein. So level 2's at the top, level 3's essentially in the middle, level 4 is low down near the clavicle, and then the posterior triangle lymph nodes are called level 5. If they have a lump in the neck in a certain spot, it may suggest that they have a cancer or a lesion in a certain area of the head and neck, whether that be on the skin or whether it be within the throat. Traditionally, most of our patients with true head and neck cancers have all been big smoker drinkers, but these days there's a lot less smoking than what there used to be, and people are drinking less than what they used to in the past. So the incidence of head and neck cancer, or particularly of cancers of the mouth and the throat and the voice box, have decreased. Over the past 20 years, it's become clear that there's been another cause for cancers of the head and neck, or cancers at the back of the tongue and of the tonsil tissue in an area called the oropharynx. And that's due to a virus called the human papillomavirus. That virus, which we all get exposed to, has many different subtypes. And there's a particular group of viruses or subtypes of the human papillomavirus which can result in a cancer of those areas. And a lot of those patients may only present with a lump in the neck. And typically, they present with a lump in the neck in this top part of the neck, deep to the sternomastoid muscle. So in this area called level 2 and level 3. And that would be the most common way that patients these days would present with that sort of cancer. When we talk about head and neck cancer, most of the cancers that we're talking about are cancers that are of the lining of the mouth, the back of the tongue, the top of the throat, the back of the nose, down around the larynx, and the lower part of the pharynx that leads into the esophagus. However, there are other areas that head and neck surgeons and head and neck cancers occur in. Most commonly, we see lots of skin cancers which can spread to other parts of the neck. It can spread to the parotid gland here, and it can spread down to lymph nodes lower down in the neck as well. We may see cancers that have come from the sinuses that it can also spread into the neck. So there are lots of different places that cancers or lymph node metastases can come from in the head and neck. Lower down in the neck, in fact in the bottom part of the posterior triangle, or level 5 and level 4, rarely, but sometimes we'll see a lump that appears, and it could be due to a cancer in someone's lung, their breast, or even a cancer of the pancreas. And the other big cause for getting malignant lumps in the neck is from lymphomas. So they can occur anywhere where there's lymph node tissue in the neck. So again, just to reiterate what we're looking for and where the lymph nodes are, there's level 1 lymph nodes, which are in the submandibular triangle, which are related to the submental area, the submandibular gland, and then the deep cervical chain of lymph nodes, which we classify as level 2, level 3, and level 4, which are deep to the sternomastoid muscle. And it's important because when we examine the patient, we have to have a good feel under that muscle to feel for those lymph nodes. Level 5 is an area where we can see lymph nodes which can come from the skin, and they may also be lymph nodes that can come from inside the throat as well. So it's always more difficult to work out where a cancer's come from when we see a metastasis or a lymph node in the posterior triangle. Now I'm going to show you how to examine the neck on this patient. First of all, I just want to reiterate when we look at the neck that the main thing that we see is that the neck is the top of it is the mandible here, and then the clavicle down below. In the midline we've got the larynx, and then the structure that separates the anterior triangle and the posterior triangle down here is the sternomastoid muscle. So as I was explaining on the model previously, when we talk about the lymph nodes occur in different areas of the neck. So this area up here, which is traditionally called the submandibular triangle, and this area the submental triangle, we call this level 1. And then deep to the sternomastoid muscle, where the internal jugular vein runs, is the deep cervical chain of lymph nodes. And they're divided into level 2, level 3, and level 4 down in the bottom of the neck. And then the posterior neck here, behind the sternomastoid muscle, and in front of the trapezius muscle here, is called level 5. And so when we can feel a lump, and there's a malignant lump that's in a certain level of the neck, it may suggest to us where that lump may have come from, so where the primary cancer may be. So it's important to be able to think where the cancer could have come from. Could it come from inside the mouth? Could it be coming from the back of the throat? Or could it be coming from the skin or even the parotid gland on the side of the face? So I'm going to go ahead and show you how to do the examination now. So normally what I would do is look at the patient first, see if I can see if there's any obvious lump in their neck, and then examine each side of the neck separately under here. So I usually run my hands from in front of the ear, so this is over the parotid gland, and then around the angle of the mandible, then under the mandible up to the submental area, and we repeat that on both sides. And that way you can feel any lymph nodes which are at the very top of the neck related to the submandibular triangle, submental triangle, or to the parotid gland. So I'm going to show you how to examine the rest of the neck. So you come behind the patient. The best thing to do is actually put your hand on top of the patient's head gently, and most patients don't mind you doing that. Just turn their head away slightly, which puts the sternomastoid muscle on a little bit of tension. And then you can again have a feel under the mandible here in the submental and submandibular triangle, and come back to this area under the sternomastoid muscle, which is level 2, or the deep cervical chain, and then you can work your way down under the muscle. But you have to get your hands under the muscle. Now, believe it or not, that's actually not very painful for patients. Sure, if they've got a painful lump, yes, that could hurt, but on the whole, it's simply a matter of getting your fingers around the front of the sternomastoid muscle and actually having a feel underneath to see if you can feel any lumps in the cervical chain of lymph nodes. And then in the posterior triangle, again, run your fingers down and have a feel and see if you can feel anything. This area at the bottom of the posterior triangle is what is called the supraclavicular fossa, so it's important to make sure that you have a feel down there. And then typically run your fingers back up along the front border of the trapezius muscle and come up here and have a feel in the suboccipital triangle, this area here, the occiput, and in the postauricular area, just to make sure there are no lumps there. So this area particularly, we're worried about skin cancers or cancers of the skin that metastasize to a lymph node in this area at the top part of the neck of level 5. Again, we palpate submental triangle, the submandibular triangle, and then palpate deep to the sternomastoid muscle, working through level 2, level 3, level 4, then back into the posterior triangle. You can start down in the supraclavicular fossa, feel in that area, then work your way back up the posterior triangle, have a feel of the suboccipital and the occipital areas, and then in the postauricular area. That's really how to examine the neck, and that's a thorough examination of the neck. So if I see a patient who comes in and I feel their neck and they have a lump here in this area called level 2 up the top, I immediately think, have they got a cancer of the mouth or a cancer of the back of the tongue or of the tonsil tissue, the top part of the throat. It might even be a cancer that's at the back of the nose. So if I see someone who has a lump further down in the neck, down in this bottom area called level 4, I'd be more worried about, could they have a cancer lower down in their throat, so somewhere around the voice box area, or even in the thyroid gland, which is in this area as well. Where the lymph node is often gives you a guide to where the primary cancer may be in the head and neck. So let's go ahead and have a look at this patient's mouth. So when I examine the mouth, the first thing I do is just ask the patient to open their mouth. Okay, and just have a general look. Have a look at the lips, make sure that there's no evidence of any problems with the lip. Can you just poke your tongue out for me? Thanks, Brett. And just move your tongue from side to side for me. So I just have a look and just make sure that the tongue movement's normal. That's the first thing that we do. And then I can have a look at the buccal mucosa and systematically look at that and look in the gingivobuccal groove, so that space between the teeth and the gingiva and jaws and the buccal mucosa, and work my way around. You can do that around the front, have a look in the gingivobuccal groove, then around to the right hand side, and again you can get a great view and you can do it all the way around. It really gives you a fantastic light. So the last, or not the last area, but the next area to look at is just look at the top of the palate here. Now I'm just going to get Brett here to just breathe in and out through the mouth for me, and I'm going to depress his tongue and have a look at the back of the throat. And I can see his uvula, I can see the whole of the soft palate, I can see his tonsil tissue, and it really gives me a great view. And I can see that his tonsils aren't enlarged and that the back of his throat's healthy. And then usually what I do is grab a glove and a gauze square. Just poke your tongue right out for me. So I just grab the tongue, and then I can have a look at the side of the tongue, right down the side of the tongue, the bottom of the mouth at the front here, and then we can change that over and have a look at the other side like that, have a look at the floor of the mouth. So you can change from hand to hand. Then after we've done that, we have a look at the back of the mouth. So just breathe in and out through the mouth for me, and we can see the uvula, and we can see the soft palate, the tonsils on both sides. He has small tonsils. You can see what we call the tonsillar pillars, the anterior and posterior pillar, and the back wall of the oropharynx. And then also just to have a look at the top of the mouth, we just shine here and have a look at the roof of the mouth, at the hard palate area, mucosa, and back down to the soft palate. And then that's the end of the examination. Well, thanks, Brett. The good news is your mouth's nice and healthy and you've got no lumps or bumps or lesions in there. But I think it's important to realise that if you do see a lesion in someone's mouth, certainly if you see a lump, the other thing that you need to do is you need to actually have a feel of the lump. So you need to see what it feels like, whether it's soft or whether it's firm, if it's an ulcer, whether it's tender or not. And if someone does have a lesion in their mouth, whether